Hi everyone, welcome to the Addiction Recovery Channel. I'm Ed Baker and I'm your host. Today we have the privilege of having Sarah George on our show for an interview.
Hello, Ed. Thanks for having me again.
Yeah, thank you, Sarah. We were talking a little bit earlier. Sarah's been on the show a number of times. Sarah George is our Chittenden County State's Attorney. Sarah began her career in 2011 as an assistant state's attorney with TJ Donovan and has since gone on to 2 consecutive terms. In my estimate, Sarah, and thank you again for being on the show, considering your busy schedule. In my estimate, that's about 15 years. Is that correct?
Yeah, this past January was 15 years
How
in
do you
the
like
office.
that? How do you like that?
Yeah.
You've got so much experience, but I wanted to ask you for the beginning section of the show. I want you to go back a lot to when you first decided to enter this field. And I want you to talk a little bit about what motivated you to move into this field?
I've always been really interested in why people do the things they do from a psychology perspective. And I actually got my master's degree in forensic psychology with the idea of becoming a behavioral analyst. And through that program, I started going to jails and working with people with major mental health issues and, hearing their stories about how they got into the system and then talking to the victims of their crimes and feeling like what we were doing just was not working. And in this effort to sort of punish people, we were actually creating a significant amount more harm, not just to the person who was committing harm, but for the victims of those crimes as well. So I decided to go into law school instead and try to be a part of the system a little earlier than a forensic psychiatrist would be. And yeah, in law school, I did a little bit on both sides and realized that prosecutors are really in a unique circumstance and a unique position to both hold the people accountable and really center victims in that conversation, but also to work with the community as a whole to sort of bring people back into our community better than they came in.
Yeah, that's beautiful, Sarah. And I think we touched about that a little earlier. This idea of a prosecutor, it doesn't really seem to capture the essence of, what people in your role do or should be doing. It's much more expansive.
I say all the time that I use my psychology degree far more than I use my law degree. Some days, you feel like a social worker when you're talking to victims and hearing about the experiences they've had, and when you're hearing from the people who committed harm and the experiences they've had. Most have been victims themselves of some pretty significant trauma. It's a lot of social work.
I am a social worker, as you know.
Yeah.
And I've often considered that, how law and social work and medicine, theology, in the best case, they're really in the same ballpark, trying to make the world a more just place to live.
Yeah, absolutely. And make when they're better, we're all better, right? When we heal people, the whole community is healed.
Yes. So now I'd like to stick with your motives and your beliefs for a little while. In your publication, you mention true justice, meaning accountability and fairness, not punishment for its own sake. Yeah. What exactly do you mean by that, true justice?
Yeah, what I mean is that historically, the position of a prosecutor has been seen as a punisher. Somebody commits a crime and you punish them for the crime. And the 200 plus years we've been doing that, the evidence is just overwhelming that it doesn't work. It doesn't help to limit further crime or lower recidivism rates. In fact, there's pretty significant evidence that punishment for the sake of punishment makes us all less safe, that it actually makes people more likely to engage in further criminal behavior. So it's just rethinking the role of a prosecutor and thinking about what victims really want, which is actually rarely punishment. Most victims just want to know that the harm isn't, they want to be healed, and they want to make sure the harm doesn't happen again. So really digging a little bit deeper than just punishment and figuring out how we can make this person better. And in the meantime, make sure that the victim's needs are being met, and treating people with humanity and compassion, knowing that that actually makes us all more safe, and it creates a system that's more fair.
Well, let's unpack that a little bit. I mean, I think it's very appealing to think that way. How do you operationalize it, though? I mean, how can true justice heal communities and keep us safe?
By focusing on what harm was committed and how we heal the harm, not what crime was committed and how do we punish the crime. By asking the person who committed the harm what led them to this behavior, what do they need to meet their basic needs to make sure this doesn't happen again? Why were they stealing food from this store? Is it because they're unhoused and don't have any money for food? How can we address that issue? Rather than just punishing the stealing of the food, how do we make sure that when you leave our system, you no longer need to? It takes more work. You know, I mean, it's very easy to just charge them with felonies, put them in jail, get, a sentence of incarceration. But again, the data is very clear that actually makes all of us less safe when they do eventually come back into our community. Yeah. So if we take a little bit more time up front, figuring out what this person needs to be a better member of our community, and doing what we can to connect with social services to make sure that we can get that. It's more work. It's a lot more sort of intensive in terms of getting that information from people, but I do believe that it's worth it in the end.
It sounds to me like there's a little bit of that forensic psychiatrist blooming right there, because it's so familiar to me as a social worker about symptoms. Yep. And then the cause of symptoms.
Right.
So when you deal with symptoms only, you are repeatedly just dealing with the symptoms because they're symptoms.
Yeah.
When you deal with the cause, then you're getting at the root and you're actually affecting change. Is that, does that capture what you're talking about when it comes to our human condition?
Yes, absolutely. And it stemmed for me, again, in my master's degree program, talking to people with mental health issues who were incarcerated, some of which who had committed really horrific offenses, and hearing about their childhoods of being trafficked or sexually abused, or violence against them for years, within the household or outside of it. We're perpetuating these traumatic histories of people and expecting different outcomes without actually doing anything to address the underlying harm.
Yeah. So I think you mentioned that it is more work, and that's an understatement. But we have to do it.
Yeah, it's more work. It's nuanced. It's important, though. I think that we have a history as prosecutors and as a law enforcement in a law enforcement world of not doing it, and look where we're at. We've got more people incarcerated than any other country in the world, and we're at the low, very low, like bottom 2% in the peace. In our terms of our safety.
And so many of the people incarcerated in the USA are incarcerated for a relatively minor drug crimes that they've committed essentially because they're addicted. Yep. And it becomes a way of life. I mean, do you have any comments on that? I mean,
you're exactly right. We have so many people. And in Vermont, too, serving either sitting in jail pre-trial because they can't afford bail, or sentenced to jail for drug offenses or incidents related to drugs or addiction. And there's, again, evidence to show and research that shows that people who go into jail for nonviolent offenses are more likely to commit violence when they return to our communities because of what they're exposed to in jail. So not only are we not fixing the problem, we're actually making it worse, not just for them, but for the rest of us.
You know, I see. And part of your My Message statement, which I've read a number of times, and I think we talked a little bit earlier, it's very inclusive, but it is really a good read. How do people get their hands on that, My Message?
It's on my website, and we're handing it out whenever we're at community events and giving it to people.
Yeah.
But I would say the easiest way to get it is on my website.
And what's your website? How do people get to your website?
It's sarahgeorge4sa.com.
Sarah George?
4SA, F-O-R-S-A, like state's attorney.
So Sarah George, the word for,
Yep.
S-A.
Yep.
I would recommend the viewing audience and anybody who the viewing audience can relay the message to take a look at that. Sarah George 4SA, My Message, because Sarah has really, collected a lot of her ideas, a lot of her beliefs, a lot of her intent, and some history also, and some projections about your future path, which is very, very informative. In your message, one of the things that I was most drawn to is this idea of what true justice is not. True justice is not putting people in jail because they do not have homes. I would like you to address that a little bit, because it's a dear area for me.
Yeah, I mean, I'm just, a lot of people in our community are upset about the number of unhoused people, and they should be, right? We should all be really upset. I think the difference is that when I see unhoused people in our community, I'm upset that they don't have homes. I'm upset that we aren't doing more as a state to build or allocate safe, affordable housing for people in our communities. But some people look at that and are upset that they're not in jail. Mm-hmm. And I think that this idea or this narrative about public safety has been really harmfully intertwined with a narrative around homelessness, and that people assume that if they are in the unhoused, then they must be committing crime and they therefore should be in jail. Or even if they see them engaging in open drug use, for example, their response is, well, I don't want them to be here, I want them to be in jail.
Yeah.
And I just think, it's not a good use of our very limited resources. We could spend a lot less money housing them and giving them access to resources than we could. It costs $310 a day to put somebody in jail, where they're not going to get any of the resources that they need. And so I'm constantly just sort of challenging people about, do you actually think that person should be in jail, or do you just not like seeing somebody struggle, which is very fair.
Yeah.
I don't like seeing people struggle, especially in my community. But again, it's a little bit more nuanced, and we have to think a little bit more strategically about what the response to that is, and whether or not we as a community want to be the type of government that just puts people in jail because we don't want to look at them suffer.
Yeah.
So that's what I mean by that, is that just because somebody is unhoused doesn't mean they should be in jail. Even if they are engaging in some criminal behavior, it is still not economically or morally, in most circumstances, better that they be in jail.
It doesn't change anything.
No, and again, it actually makes us less safe because of the environment that they're exposed to when they are in jail.
And a closely related point is true justice is not putting people in jail because they have substance use or mental health issues. So that idea of being unhoused with perhaps substance use and mental health issues is on our agenda in Burlington. And I want to just say for a moment that I have a lot of compassion for people who think very punitively about this particular group. I think that they have been manipulated.
Yeah.
I think their fear and their concern has been manipulated to cause them to think in overly punitive ways. And That's why, people like you coming on the show and talking to an audience, I think is so important to help people to think a little bit differently, to approach this just a little bit differently, and as a result, get better outcomes.
Yeah. Again, I think it's just more nuanced than that, and I do think that a lot of people have been fed this narrative that is going to fix things. That if only we put more people in jail, and again, we have been doing that for 200 years, and it is not making us any more safe. And again, in fact, the opposite. The more and more our incarcerative numbers rise, the less safe we are. So we have to stop pretending that this thing we've been doing for decades that doesn't work is somehow now going to fix all of these societal issues that we're dealing with.
Yeah, and related to that, I mean, and this, let me say again, my message is so comprehensive. One of the other things you mentioned is right along those lines, using fear, panic, and taglines to build support and momentum. To put these populations in jail, to come at them completely from a punitive perspective just doesn't work.
Right.
But it seems to be popular on many levels it seems to be saturating. The media, coming from all levels of government. What do you think about that? What do you think about what's happening from the federal, level on down? What's your take on that?
Yeah, I mean, I think it's horrifying. I think that the way in which our federal government is using police and prosecutors as tools to enforce a fascist agenda is really terrifying. And I think that the way we see that trickle down into our own governments is really scary. And I think we have to be really, really careful about how much of Trump's work we're doing for him when we feed into some of these narratives and when we use fear and fear-mongering and to these taglines to try to change people's perspectives or trying to build momentum for a more incarcerative system that does not work, that has been proven not to work, and that we don't have the money to do, even if that was what we wanted to do, which I don't think as a community it is. I think that those voices are loud, but I don't think they're the majority in our communities and in Vermont. So we need these. We need this really ground movement and ground work to be done by people who understand the facts and understand the data and are not using fear to build momentum, because it's dangerous to use those narratives. It's dangerous for the people that we're talking about, and it's really dangerous for the folks that are trying to do things differently and trying to spread a more factual message.
You mentioned the punitive voices being loud, but not in our community, or not the majority in our community, because this is Vermont. And along those lines, I attended a hearing last night. It was a House Judiciary hearing on Proposal 4 to amend the Vermont Constitution. And I'll read you just a little bit about Proposal 4, and the audience also. Proposal 4 specifically states its intent to expand upon the principles of equality and liberty by ensuring that the government does not create or perpetuate the legal, social, or economic inferiority of any class of people. It furthermore states its intent to protect the rights and dignity of historically marginalized populations and address existing inequalities. Now, I don't know about you, but that's music to my ears. What do you think?
I mean, it's absolutely, and it's really shocking that we have to be having a conversation and an argument about whether or not that's
true.
That's really what's best. But unfortunately, that's our reality. Our government has a history of perpetuating and creating laws that disproportionately impact people of color, people with mental health issues, certainly LGBTQ plus folks, women, and again, racial minorities. And so
people with substance use disorder.
Yeah, so anything we can be doing to try to hold the government a little bit more to account on that, to protect the people in our communities from this discrimination. It's the people who are against it, I think, are telling on themselves a little bit, and it's really unfortunate to see that even here that is being argued against is unfortunate. It's a reminder that, like I said before, those certainly are not the Vermont values that we hold dear, but there are some folks that still have those values, and so this conversation is important, and we need to do some of these things even when we think it might not.
Yeah, I think it's absolutely essential and crucial at this moment in time to have this conversation, and this proposal, I think, brings it to the forefront. There'll be debate, and so be it.
Yeah.
And then we need to be loud now about this.
Yeah.
It's like an epic moment, really.
Yeah.
In history.
It is, and when you see what's happening around the country with gender affirming care and laws that are voter suppression issues and racial inequality that has always been there, but is coming to fruition in so many other areas. It's important that Vermont be really clear about where we stand and what we will and won't tolerate.
Well, we'll go into another segment in a minute, but I wanted to ask you about something. So what would true justice look like? We talk about true justice for the disenfranchised, population, because that's the population that is like tending toward more and more being abused by the system. What about true justice for the other population that is not disenfranchised? People who are well-to-do and middle class and getting along and, sort of like just living their lives and, worried about the things they worry about. What does true justice look like for them?
Well, I think true justice for them continues to look the way it does. It's making sure that everybody else has that same experience that is important. I mean, the foundation of our legal system is built on the oppression of poor people and people of color. So it has never been unfair or discriminatory as a general practice against wealthy folks in our communities. Frankly, I think a true justice could mean holding them accountable in the same way that others are held accountable. Because right now, most individuals who are wealthy are not being held accountable to the same standard as people who are poor. Mm-hmm. So it really is about making sure that everybody in our system is treated the same. And my hope certainly is that people who are Black, brown, and broke are being held to a better standard within our system and a more fair standard within our system that looks a little bit more like their wealthy counterparts.
It's like affirmative action for justice.
Yeah, it is. And it's, again, it is something that takes more than just one person. This is an undoing of an entire foundation, the entire foundation of our legal system. Mm-hmm. This is not just one or two cases, or it's not even 1,000 cases. It is really making that effort on the way in which our laws that are built on a discriminatory framework, the way that they are implemented, the way that your practice within a prosecutor's office is implementing these laws. That were designed to disenfranchise.
It brings to mind critical race theory and the way our country was, built, upon slavery and racism, and how deeply embedded in the fabric of law racism, has become. When I think of it, because I've studied more addiction, recovery, harm reduction, that's what's closest to my heart. I'm a person in recovery from severe drug use disorder. And I do believe that the stigma that affects people who use drugs is very akin to the racism that affects people of color.
Yeah.
I see them as kind of running parallel in our society and deeply, deeply embedded. And that's why I think this proposal 4, calls our attention to that.
Yeah.
That it's systems of government that perpetuate
Yes.
people being treated as less. And I think that is what your career is really about.
Yes.
At getting in there, getting into those systems that perpetuate this and changing that, hopefully once and for all.
Yeah, and having really uncomfortable conversations about the history of our legal system.
Mm-hmm.
As a lawyer, and a lot of prosecutors will say, well, I don't make the laws, I just enforce them,
Yeah.
which is, from my perspective, really disingenuous. One, because prosecutors do make laws. If you have ever been to the State House when a public safety law is being created or discussed, there's always a prosecutor lobbyist there, or our executive director. There's law enforcement lobbyists there. We absolutely are a big part of the creation of the laws. But yeah, when slavery was, quote unquote, abolished, that is when a lot of landowners lost their free labor, and so there was the creation then of prisons and new laws that would absolutely disproportionately impact people of color, so they'd be incarcerated, and then they'd get their free labor that way.
Yeah.
And that is, again, 200 years of doing that. We forget where we started, and it's incredibly important from my perspective to be really honest about that.
Well, we either forget where we started, or, like you and I, we're born into it.
Yeah.
We were born into it.
Yeah, absolutely.
And then miseducated about it, like somehow it's okay.
Yeah.
It's not okay.
Yeah.
But breaking free of that sometimes is difficult.
Yeah.
Breaking free of what we've been taught
Yes.
sometimes is very difficult.
Yeah, and like you said, the media still perpetuates that. Fear-mongering political pundits still very much perpetuate that, and we continue to believe it because we continue to see it. We see it play out, and we use that as evidence that it's true instead of breaking down.
Yeah, I'm with you on it, and it's huge, it's epic, and it's current, it's present, it's now.
Every day. Yep.
I first met you a while back, and it must have been maybe 2015, 2016, around that point, working with a team of advocates beginning to support overdose prevention centers. And we've come such a long way.
Yeah.
We've had legislation. The governor had vetoed a number of legislative efforts. And finally, this last time, with Taylor, Small, and others, certainly Ginny Lyons. There were people, I won't try to go through all the names because I'll leave a few out. But people like yourself, Selena Coburn, we've had success. We overturned a veto.
Yep.
The creation of an overdose prevention center in Burlington is part of legislative law now. We've had success in the Opioid Settlement Advisory Committee. It was a unanimous vote to fund the Overdose Prevention Center. A unanimous vote. It was their crowning moment. We have guidelines through the Department of Health. The mayor's office has entered into a contract with Vermonters for Criminal Justice. We're on the verge. What does that mean to you when you look at that, having been such an integral part of that?
It's really cool. I mean, I don't know how else to say it. It feels really amazing to be a part of something really early on and get a lot of pushback about it, get a lot of hate about it, and then to see the narrative shift and to see people coming along and to see people changing their perspectives and to see just a growing momentum around humanity and compassion for people using drugs. And, you know, I still think there's a ways to go before we have the sort of understanding that I would love to see everybody have, but it has been a wild experience to be a part of it from the beginning and have so many people against it. It's also a good reminder in general of when we see something that makes us uncomfortable, our initial reaction is to be against it. And, you know, how often in history have we seen that turn out to not be the scary thing that people have thought when they first oppose it? In such a short amount of time, to see how many people have kind of come around to it. I hope that with the next thing that is so controversial in the beginning, people can quickly remember how that rarely plays out as the scary thing.
I can remember great resistance toward methadone.
Exactly.
Great resistance toward buprenorphine.
Yep.
Great resistance to safe syringe programs.
Yep.
Great resistance actually to recovery centers.
Yeah.
We went through recovery, they're all going to come here.
Yeah.
You know, there was so much resistance to these things that have saved so many lives.
Yeah.
So many lives over the past, and you've been instrumental in some of those. I want to, there's one vignette I'd like you to just, I can remember when, I hope I get this right, it was you, Miro Weinberger, the mayor at the time, Brendan Del Pozo, the police chief at the time, and TJ Donovan, the Attorney General. If I've left someone out, correct me. But the way the story goes is that you collaborated in private and agreed to not prosecute people for possession of small amounts of buprenorphine for personal use, and because you realized that they were attempting to treat their own disease of addiction. And when I mean, this to me was so precious, and that sentiment or that effort actually spread and became a law. State law. Is that true?
Yeah. I don't believe TJ was a part of it, but Dr. Leffler was at the UVM Medical Center, which I think was a really important partner in that work, because, you know, they were ultimately a partner in providing the buprenorphine on a 3-day prescription for folks that came into the emergency room. And that, you know, our entire message was that we wanted to flood the community with buprenorphine because we wanted people taking that if the option was that or fentanyl that was likely to kill them. It's
the closest we can get right now to safe supply.
Yeah, and when I first started learning about it and understanding it, to think about the fact that it was still a law on our books at all was really, it highlighted how much stigma there is around drug use, and that even a drug that saves people's lives was prohibited to be in the hands of someone without a prescription. It's really telling where we sort of see recovery in general and how we want people to get there, which is, you know, pure abstinence or nothing. Was really
we
highlighting.
still don't embrace this idea of people just doing the best they can when they can do it. And
staying alive.
And not dying. Right.
Yeah.
You know, along those lines, I know I've spoken with you many times about mortality in Chittenden County, and you always come through for me. You always, you know, within your busy schedule, you have enough time to ferret out the numbers and send them to me. And I want you to know how much I appreciate that. And I really, I feel for you, because I know that every death that occurs, you have to kind of look into personally. And if there's anybody close to, you know, accidental overdose death in Vermont, other than the families of loved ones who have passed away, you know, it's Sarah George. And that has to be excruciating. I mean, just what was it, in 2022, 54 neighbors in Chittenden County, that's not Vermont. That's over one a week. 2023, 52. one person a week
Yeah.
that you had to look into who died of accidental drug overdose. Now, I know in 2025 the number is down to 27, but I'm suspicious of that because there's probably X number of cases that are not verified yet or concluded yet. So we've seen a decrease in deaths, and I'm happy about that. But to me, this remains urgent.
Absolutely.
We don't lose urgency because the number of deaths has declined. What is your take on this?
Yeah, I completely agree. One, I think that even if it was 27 in the best of circumstances, that's still one every other week in our
Right,
community,
right.
which is should not be something we celebrate. I also think, and you know that I track as well, what I consider the sort of other causes of death, and that's sepsis or other bacterial infections endocarditis that come from drug use. We have some that are, cocaine technically, but they might also have fentanyl in their system. And so we have all of these other kind of co-occurring deaths that might not be a mixed drug intoxication death, but are very much connected and are very resource and cost intensive for our state. So if we're really thinking about addressing the issue, all of those people and all of their deaths should be a part of the conversation. And I do think that number would be higher if we took that into account, the people who are dying at the hospital after long infections or other.
And sometimes the sentiment out there, and I hear people saying it, oh, look how good we're doing, we should spend that money on something else.
No, I mean, that number should be zero.
Yeah, how much more can stigma,
yeah.
Be evident when you hear comments like this? These are people dying. I know you know, and I both know parents and family members of people who have been lost to unintentional overdose. And once you begin to talk to them and feel what they feel, you can never see this any other way but as urgent, and it will remain urgent.
Yeah. I feel the same way about the people dying by suicide in our community. We are not talking enough about how many people we're losing every year in our county and our state from gun violence or gun-inflicted suicides.
I engaged the health department, the Department of Health, a year or two ago, and I said to them, I want to know what the leading cause of death is in Vermont for Vermonters 60 and below.
Yep.
And it took a little while. They ferreted it out. It was accidental drug overdose. The leading cause of death in Vermont for Vermonters 60 and below is accidental drug overdose. Now, tragic as that is, the second leading cause of death for that same age group is suicide.
Yep.
So, I mean, how can you turn your back on that?
Yeah.
Yeah.
Yeah, and I track those as well, and the number of young people too, like 20s, 30s, dying by suicide. I just don't know why we're not talking about it more. And I think I have this unique perspective because we're called for every untimely death. My office is called, and so we get these autopsy reports, and how many people I get these autopsy reports for that I'm like, why isn't anybody talking about this?
Yeah.
A 19-year-old who died by suicide.
Talking about it with the urgency
Yeah.
that it commands, for sure.
Yeah.
I can't thank you enough. I can't thank you enough. And I really mean that for the work that you do and the position that you take and the person that you are. And we're going to end the show in a moment. I want to read one of your comments from my message under the heading Moving Forward Now. You say, true justice means accountability and fairness. Justice is not about punishment for its own sake. It's about accountability that heals communities and keeps us safe. While Trump and his allies try to turn prosecutors into political enforcers, in contrast to Vermont's values of fairness, independence, and compassion, I am committed to fight for justice in every case that is fair, smart, and free from fear. So I want to, in closing the show, I want to give you the closing moments to say to the audience, the viewing audience, what Sarah needs to say to the audience. What do you need to say to people watching, Sarah?
No, you just said it for me. But
say it again.
First of all, thank you for having me and thank you for your support. I really love my work. I love what I do. I'm really proud of the work I've done. I'm proud of our community for supporting the work that I've done. But we do still have work to do. And I think that the more that we stand together, the more that we work together and we collaborate with nonprofits in our community, with law enforcement, with people who cause harm and who, victims of crime. If we actually come to the table and look for real solutions that are supported by data and research, I am excited to see what our community can accomplish. And I think that we have the will to do it. We have the strength to do it, but we do need to come together. And this is a moment, especially given our federal delegation, or not our delegation, our federal administration, that we have an opportunity as a community to really shut that out, to not use it to divide each other, and instead to come to the table and put this community first, and figure out how to make sure that every person who comes through our justice system is better when they leave it. There are ways to do that, and I'm excited to continue to work on that goal.
And I'm excited to support you.
Thank you.
So for the viewing audience, Sarah George 4SA.
Yeah.
And I would recommend reading my message twice. Thank you, Sarah.
Yeah. Thanks for having me again.
Yeah.